Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. Pinnaplasty or otoplasty are the same operation. It's an operation designed to reduce the prominence of the ears. Some people call it reshaping, but it doesn't change the shape of the ears. The only way to really change the shape of the ears would involve scars on the outside of the ear which are very visible and disfiguring, and often not really an option. When we're thinking about changing the prominence of the ears, there's two parts to this. There's the antihedical fold, this bit here, and the conchal bowl, which my index finger is in, and we can move that in and out. And often a combination of the two is required to give a natural, pleasing shape to the ear. Pinnaplasty is often performed as a general anaesthetic procedure, but it can be performed as a local anaesthetic procedure and takes around about 90 minutes. It's day case, meaning you can go home the same day, and I don't use head bandages. I'll simply glue the ear to the side of the head. That glue will hold the ear in a safe position for around about 2 weeks, by which point the ear will come away from the side of the head, the wounds underneath will be healed, and then you'll only need to wear a sweatband in bed at night time after that for a further 4 weeks. Using glue has the benefit of not requiring any attention and allows you to shower and wash your hair from the next day. During the procedure, you'll be given local anaesthetic blocks, which will numb the ear for several hours afterwards, which means that when you come round after a general anaesthetic version of the procedure, you should have very little pain or discomfort. After the surgery, you should expect to see bruising and purplish colour to the ears, which will eventually turn yellow. There will be some tenderness of the ears and discomfort, and you may find it difficult to sleep on your side. I often recommend that you sleep propped up on a number of pillows to minimise swelling, and put an old towel down over the pillows just in case any drips of blood or glue get onto the bedclothes. The ears will be numb to begin with, and this may last a few months. Sometimes the ears are sensitive, and I recommend you massage the ears once the glue has come away. You'll be instructed in the clinic about this. You'll have a scar behind the ear, and that scar is often red and lumpy to begin with, but settles very quickly. It may remain red or lumpy up to 18 months or more. In rare cases, you can have a keloid scar. This is a thick, lumpy, growing scar that can be very troublesome and may require referral elsewhere for treatment. Typical things to expect will be asymmetry between the two sides. This will happen in all cases. Everybody's ears are slightly different, and they'll be slightly different after surgery. I'm unable to make them exactly symmetric, and I'll point out the differences to you pre-operatively, as well as you noticing them post-operatively. Very rarely you can get suture extrusion. The permanent sutures used to hold the ear may start to erode through the skin. Sometimes these can be trimmed and managed in the clinic without any problem. Occasionally they may need to return to theatre to remove the suture. In some cases, if this occurs early on, the ear may fold back out of position and a new suture may need to be replaced. You may feel that after the surgery, the ears have been overcorrected or undercorrected. You may simply not like the shape, or it may not have achieved what you had expected from your surgery. This is quite a difficult thing, but I would have spent plenty of time with you beforehand, really trying to pinpoint exactly what you want to achieve by your surgery. Some people have prominent earlobes, and in spite of the best efforts during surgery, they cannot be corrected. Pinnaplasty surgery is successful because we can use permanent sutures to reshape the cartilage, but the earlobe has no cartilage, and therefore we are unable to suture the earlobe and maintain it in position. Attempts to remove skin or fibrofatty tissue are usually only partly successful. For this reason, some people may have slightly prominent earlobes following their pinnaplasty surgery. On average, the revision rate for surgery is around about 10%. My personal audit is in the region of 5%. Rare complications from pinnaplasty surgery include clots on the legs or DVT if you have a general anaesthetic. This procedure is generally low risk in itself for such a complication. Bleeding may occur in the ear, and this may form a hematoma. Infection can occur in the wounds, and in very rare cases an infection can affect the cartilage called chondritis. Untreated chondritis or an untreated hematoma may both lead to a boxer's or cauliflower ear, as damage to the cartilage creates a shape that would require a formal ear reconstruction to perform. This is thankfully very rare, but a real risk. There is a small risk of skin loss. This is typically caused by head bandages, which I don't use, but nonetheless a severe infection may also cause skin loss.